Hi everybody, my name is Dr. Stella Rwezaula. I'm a consultant hematologist working at Muhimbili National Hospital, a lecturer at Muhimbili University of Health and Allied Sciences in Dar es Salaam, Tanzania, and a PhD candidate at the University of Lagos. I would like to welcome you all to our interesting article titled "The Journey Towards Excellency in the Care of Patients with Haemophilia and Other Bleeding Disorders from a Developing World, Insight from Tanzania." This article aims at presenting a narrative review of the key steps and activities undertaken to improve care of patients with hemophilia and other bleeding disorders in Tanzania, as one among the low and middle income countries in sub-Saharan Africa. Data in this article were gathered from healthcare providers, patients, caregivers, government officials, policymakers, and other stakeholders in the health sector. The main objectives in this article were to assess the journey we went through towards improving care of patients with bleeding disorder in Tanzania. Secondly, was on how we built capacity in terms of diagnosis and treatment, infrastructure, and human resource development. Here, we managed to establish 14 hemophilia treatment centers in the country from zero within 4 years. This article also shows how we trained different specialties of healthcare providers, patients, caregivers, and the community at large on bleeding disorders. The interesting part in this article is how we managed to achieve stakeholders' engagement, including non-governmental organizations who are supporting us, the Ministry of Health, policymakers, National Health Insurance Funds, and the community leaders to ensure sustainability of these services in the country. The exciting achievement on this article was the establishment of the National Treatment Guideline and the National Bleeding Disorder Registry for the first time in Tanzania. We also shared experience on the challenging bleeding disorder cases in Tanzania for other sub-Saharan African countries to learn from us. We also showed how we integrated services for 2 blood disorders, hemophilia and sickle cell disease, using the already existing infrastructure and human resource. We hope that this article will impact knowledge and help most of the sub-Saharan African countries to establish and improve care for patients with hemophilia and other blood disorders. Thank you very much for showing interest on this article, and stay blessed.